Welcome to the third webinar in our ongoing series, Justice Challenges and Opportunities in a Pandemic, #JCOP. In the first webinar, we spoke about the need to expand the social safety net, which includes understanding changes to unemployment insurance. In the second webinar, we discussed the importance of understanding the effects of social isolation on substance use and substance use treatment, with a focus on teletreatment. While the fallout from COVID-19 is still unknown, these webinars are focused on helping agencies prepare for possible eventualities. To that end, this webinar focuses on how probation can help strengthen families against child abuse or neglect. Since the widespread outbreak of COVID-19, some areas have reported a rise in child abuse. It is important that probation officers understand the risk and protective factors associated with child abuse. Child abuse includes physical abuse, such as hitting, kicking, shaking, burning, or other shows of force against a child. Sexual abuse, such as pressuring or forcing a child to engage in sexual acts or exposing a child to other sexual activities. Emotional abuse, or behaviors that harm a child's self-worth or emotional well-being, such as name-calling, shaming, rejection, withholding love, and threatening. And neglect, or the failure to meet a child's basic physical and emotional needs, such as housing, food, clothing, education, and access to medical care. In 2018, over 60% of abuse cases were neglect. 11% were physical abuse and 7% were sexual abuse. More than 15% were victims of 2 or more maltreatment types. Almost 92% of victims are maltreated by one or both parents. The parents could have acted together, acted alone, or acted with up to 2 other people to maltreat the child. Nearly 40% of victims are maltreated by a mother acting alone, and 21.5% of victims are maltreated by a father acting alone. Centers for Disease Control and Prevention list individual, family, and community level risk factors associated with child abuse or neglect. As you can see, individual level risk factors include a lack of understanding of children's needs, child development and parenting skills, substance abuse and/or mental health issues, and parental thoughts and emotions that support or justify maltreatment behaviors. Additionally, social isolation, family stress, and parenting stress contribute to abusive or neglective behavior. While knowing the risk factors can help an officer understand the root cause of child abuse, knowing the protective factors can help officers know how to best help fend against child abuse or neglect. Reading over the protective factors, it is clear how important both basic needs and parenting resources are to fighting against child abuse. Take a minute to read over the list of protective factors and begin to think about how you might be able to help boost a family's protective factors. Feel free to pause the slides here if you need to. One option your agency might think about is additional trainings like families curriculum offered by the Center for the Study of Social Policy. The materials for this curriculum are available at no cost and may be accessed via the link provided here. Probation will also need to develop and reinforce formal communication channels and shared procedures with local nonprofits, other child welfare agencies, and advocacy groups. Finally, we would like to provide several concrete resources related to improving parenting skills and parents' knowledge of child development. These will be available on our website, gmuace.org, and will also be linked to the accompanying newsletter to this webinar. If you would like to receive our webinar, please reach out via email or Twitter. Thank you for listening. If you have specific questions for us or topics you want us to cover, you can tweet us at correctionsgmu or email rnrtool@gmu.edu. We care about our justice partners and the work you are doing. We know you are out there on the front lines trying to do the best for our country, and we will get through this together. As always, stay safe, wash your hands, and check in with your loved ones.